Dental health. Which foods cause tooth decay? Sugary food and drinks are one of the main causes of tooth decay. Acid is produced when the bacteria in your mouth break down the sugar. The acid dissolves the tooth surface, which is the first stage of tooth decay. Sugar in food and drinks. Some sugars occur naturally in food and drink, such as fruit, honey and milk. The naturally occurring sugar in dried fruit, such as raisins, dates and apricots, can also contribute to tooth decay. Other foods have sugar added to them by the manufacturer, which is sometimes called processed food. These may include cakes and biscuits, soft drinks such as cola as well as fruit juice, sweets and chocolate, flavored milks and yogurts, sugary breakfast cereals and cereal bars, jams, fruit canned in syrup, sauces and syrups, such as some pasta sauces, marinades and ketchup. Why should I use dental floss? You're advised to use interdental brushes in addition to brushing as part of your daily oral health routine from the age of 12. Some people may not have large enough spaces in between their teeth to use an interdental brush, so flossing can be a useful alternative. Your dental team can show you how best to clean between your teeth. How to use dental floss. Dental floss is a thin, soft thread. If you find floss hard to use, you can try dental tape, which is thicker. Do not be too aggressive with the floss, you risk harming your gums. The main action of flossing is a firm but gentle scraping of the tooth from the top down. Your dental team can advise you about using dental floss. Flossing tips. Break off about 45 centimeters of floss and wind some around one finger of each hand. Hold the floss tightly between your thumbs and forefingers, with about 2.5 centimeters of floss between them, leaving no slack. Use a gentle, rocking motion to guide the floss between your teeth. Do not snap the floss into the gums. When the floss reaches your gum line, curve it into a C shape against a tooth until you feel resistance. Hold the floss against the tooth. Gently scrape the side of the tooth, moving the floss away from the gum. Repeat on the other side of the gap, along the side of the next tooth. Do not forget the back of your last tooth. When flossing, keep to a regular pattern. Start at the top and work from left to right, then move to the bottom and again work from the left to right. This way you're less likely to miss any teeth. What if my gums bleed? When you first start flossing, your gums may be tender and bleed a little. Carry on flossing your teeth as directed by your dental team, and the bleeding should stop as your gums become healthier. If you're still getting regular bleeding after a few days, see your dental team. They can check if you're flossing correctly. What if I find flossing difficult? If you find flossing difficult, your dental team can give you advice about other ways of cleaning between your teeth. Why should I use interdental brushes? Interdental brushes help to prevent gum disease by getting rid of pieces of food and plaque from between your teeth. They have small bristled heads designed to clean between your teeth, and they come in different widths to suit the sizes of the gaps. You can buy them from pharmacies and in the supermarket. How How to use interdental brushes. Aim to clean your teeth with interdental brushes once a day. Use a brush appropriate for the size of the space between your teeth. You may need to use more than one size. Insert the brush gently between your teeth, and try a smaller brush size if it feels too tight. Don't try to force the brush into the space. Work round the whole of your mouth so you don't miss any of the spaces. What if my gums bleed? When you first start using interdental brushes, your gums may be tender and bleed a little as you start to get rid of any plaque buildup. Carry on using the brushes, and the bleeding should reduce as your gums become healthier. If you're still getting bleeding after a few days, get advice from your dentist. They can check if you're using the interdental brushes correctly. What if I find it difficult to use interdental brushes? If you find it difficult to use interdental brushes, get advice from your dentist or dental hygienist. They can show you how to use the brushes and give you advice about other ways to clean between your teeth, such as dental floss. However, some people find using dental floss more difficult. What are dentures, bridges, veneers and dental implants made of? Dentures. Dentures are removable false teeth that fit snugly over the gums to replace missing teeth. They help with chewing and eliminate potential problems caused by gaps. You should remove your dentures at least once a day to clean them. Dentures can be made of acrylic resin, metal, a combination of acrylic and metal. Bridges. A bridge is a fixed replacement for a missing tooth or teeth. A bridge can be made of porcelain bonded to metal alloys, which may contain gold, silver, nickel, chromium, titanium and molybdenum. Metal alloys containing cobalt, chromium, titanium, aluminum and vanadium. Acrylic, plastic, for temporary bridges. Porcelain. Bridges may also be made of other non-metallic materials. You should ask your dentist what is most suitable for you. Veneers. A veneer is a new surface to fit over the front of a tooth. Veneers can be made of porcelain, composite materials, the materials that make white fillings. Porcelain veneers are more realistic looking and long-lasting but also much more expensive than composite veneers. Dental implants. Dental implants are artificial roots directly implanted into the gum and bone to hold crowns, bridges or dentures and replace missing teeth. They are available privately but can be expensive. Each implant is essentially a metal screw made of titanium. Titanium is biocompatible, meaning it is not rejected by the body and the metal will fuse with the surrounding living bone.
Thank you for watching the video. Please like and click on the subscribe button for more amazing videos.